During this lockdown, many trans men, bisexual women, and lesbians were thrown out of their jobs. Their salaries were withheld, and the pandemic was cited as a reason. Since many individuals from the LGBT community, they actually live outside their natal homes, they don't get much support, much emotional support, or much financial assistance from their natal families. And in many cases, individuals who live with their natal families, they are the sole bread earners. So it had become really difficult for them to sustain through this period because of the loss of jobs. Many among them had reached out to us asking for financial assistance. So we, from the Sappho collective, we tried to help as many as possible. We gave financial assistance to 51 people from the months of April to June for 3 months.
We have procured some fund and are planning to help around 60 trans men, lesbians and bisexual women for 3 more months with ration. As we understand that even if the lockdown is lifted, the crisis still prevails.
Providing telephonic counseling through our professional psychologists, and we have kept our helpline open 7 days a week for the community.
So the real challenge was the inability to reach out to more people due to the physical distancing imposed upon us.
We were getting a lot of cases where violence had been meted out to LGBT people. We were completely dependent on our phones and on technology, as reaching out to them physically had become a huge challenge.
To the people from the queer community, all that we want to say is, this too shall pass. And we are all together with you, not just during this pandemic, but also after. To remain safe, secure and healthy is your right. And to the people from outside the queer community, please do not hesitate to help others who are in distress or in need of your help. Remember, each and every life matters.
Namaskar, I Lakshmi Narayan Tripathi thank every donor who has associated with Kineer Services in this crucial pandemic COVID-19 to provide food grains for the transgender community, whether it was state of Delhi, Mahipal, Patna, Allahabad, Bengal, Kolkata, and in Bombay, Thane, Badlapur, Ambernath, Ulhasnagar, Nasik, Kolhapur, Amravati, Nagpur, in Gujarat, Ahmedabad, Surat, Rajkot, and whether we are trying our level best to see to it that in this pandemic situation, nobody dies because of hunger. I thank Donate Cart and other organizations, whether it is Phool Varsha, Namo Yodan, all who has helped Kineer Services and made us food grains available. Thank you so much.
নমস্কার, আমি মধুজানন্দী, একজন রূপান্তরিত নারী। আমি দীর্ঘ 23 বছর এই ডেভেলপমেন্ট সেক্টরে কাজ করছি। আমি বেসিক্যালি অ্যান্টি হিউম্যান ট্রাফিকিং নিয়ে কাজ করি, তাদের রেস্কিউ, রিহ্যাবিলিটেশন, রিইন্টিগ্রেশন এগুলোকে নিয়ে কাজ করে থাকি। আমি বার্তা ট্রাস্টের একজন ট্রাস্টি বোর্ড মেম্বার। এই কোভিড-19 সিচুয়েশনে, ক্রাইসিস সিচুয়েশনে এলজিবিটি কমিউনিটি বিভিন্ন রকমভাবে বিভিন্ন দিক থেকে ব্রাত্য। আমরা সমাজের বিভিন্ন রকম দিক থেকে দেখা গেছে যে এই কমিউনিটি নানান রকম দিক থেকে ডিসক্রিমিনেটেড, স্টিগমাটাইজড। তো আমাদের বার্তার তরফ থেকে আমাদের প্রচেষ্টা হচ্ছে এই কমিউনিটিকে নানান রকমভাবে রেশন রিলিফ দেওয়া, তাদের নানান রকমের রেফারেল সার্ভিসে প্রোভাইড করা, তাদের বিভিন্ন রকমের সুযোগ সুবিধা করে দেওয়া এবং ট্রেনিং, অ্যাডভোকেসি এগুলোতেও সাহায্য করা এবং এই সিচুয়েশনে দাঁড়িয়ে তাদের যে মেন্টাল মানসিক স্বাস্থ্যের দিকটা অবশ্যই দেখা। তো এছাড়াও আমি একটা কথা বলবো, যেটা হচ্ছে আমরা বার্তা ট্রাস্ট শুধুমাত্র এলজিবিটি কমিউনিটি নিয়েই আমরা ফোকাসড নই। আমাদের বিভিন্ন রকমের সমাজের প্রান্তিক শ্রেণীর মানুষ, সেক্স ওয়ার্কার, এছাড়া ইন্টারভিনাস ড্রাগ ইউজার্স, এদের সকলকে নিয়ে আমরা কাজ করি। সমাজের এই এলজিবিটি কমিউনিটি ছাড়াও সকলকে নিয়ে আমরা কাজ করার আমাদের প্রচেষ্টা একসাথে। আমি সকলকে অনুরোধ করব আপনারা দয়া করে বার্তা ট্রাস্টের যে ওয়েবসাইটটি আছে vartagen6.org সেটা ভিজিট করুন এবং বার্তা সম্পর্কে বিশদভাবে জানুন। নমস্কার।
We are Xomonnoy, an intersectional queer feminist group based in Guwahati in the northeast Indian state of Assam.
We have basically done 3 things for the queer community during this pandemic.
Firstly, we collected and distributed money among the needy people from the LGBTQIA+ community across Assam.
Secondly, we have started a helpline number so that the community can reach out to us at any time.
And lastly, we have organized a lot of online activities like story collection, live TV, live videos to continuously engage with the community.
Collection of financial resources was and still is a big constraint in our functioning.
This is because the welfare of the queer community comes towards the end of the priority list for most of the people.
Moreover, petty politics amongst activists and working groups has posed a big challenge for us.
At this point of time, we would like to say to the people within the community that we are in this together. Whatever it is, we are there for you.
Please join us in creating a safe space for the LGBTQIA+ community. We need each other.
For the people outside the community, we are not asking a lot from you.
Just be a little kind.
Stay safe.
Hi everyone, my name is Vandita Murarka and I'm the founder and CEO of One Future Collective. Under One Future Collective, we also run the Cure Rights Center with a twofold mission. One is building awareness, visibility, and just general knowledge about queer rights and identities. And the second being building youth queer leadership, which includes nurturing and transforming safe spaces for them. When COVID-19 hit, for a little while we were at a loss because we didn't know what we should be doing. We didn't know what the response from our side should be like because we're not a disaster relief organization. But then we realized that in this moment, we're called to do way more than we might have imagined ourselves doing when we started out. And this is a moment that none of us have been prepared for. So over time, we took a couple of weeks and we adapted some of our work to be able to meet current existing needs. The first thing we did is we expanded the hours of our Fem Justice Helpline, which provides free legal and mental health preliminary care to survivors of gender-based violence, including queer people. So we made sure this was available through the week for people who might be in unsafe situations. And we also started creating resource spaces, a guide, to be able to provide supplementary information to those who can either not reach us directly or those who may not want to reach us directly. Because we did notice a spike in cases of violence, not just in domestic violence between cis heteronormative persons, but also in violence against trans persons and other queer identities. The second thing that we did is we shifted our safe spaces online. We run a Rainbow Club, which is a space for young queer people to come together and go on co-leadership journeys. And we also run a healing circle for queer people who might have faced violence, stigma, or other forms of harassment and discrimination. And it allows for them to come together and heal with the support of a trained mental health professional. We shifted these online as far as possible, and we adapted their formats to include people who could join with very low access technology as well. And then third, we realized that there is an immediate need for funds to go out to specific queer communities. So we earmarked 25% of all of our revenue and donations since April started towards specific causes in direct financial relief. And a major part of that has been support towards queer people, including trans persons stuck in different situations with no access to any new income. And we realized that we had to adapt our work really quickly to be able to meet these needs. And these have been learnings for the sort of work we want to be able to do in the future as well, where it's adaptive, it's flexible, and it can truly meet the needs of the community beyond what our vision or mission or theory of change statement might say. It has been a transformative learning experience, and we hope to be able to continue to provide the sort of support people might require. However, having said that, we also hope to be able to keep changing our work to meet their immediate needs, especially in a time of crisis like we are in right now. I think some other organizations have done brilliant work around providing direct food, ration, other monetary relief on ground. And it's been a privilege to be able to see these organizations do such work and also collaborate with some of them to create resource bases, provide direct mental health or legal support, and also be able to direct some of our funding resources. We're very grateful for that opportunity from other organizations and the collaborative ecosystem that the COVID-19 pandemic has shown can exist within the social sector. So thank you to everyone who's been doing immense relief work directed towards cured people or otherwise. It's been an immense need, and I have seen the social sector really step up and fulfill it. And I don't know where we would be if each of us hadn't taken the onus of saying, this isn't the problem someone else has to solve. It's a problem that all of us have to collectively solve. Thank you.